Bipolar depression is a mood disorder. Unlike depression where you feel very, very low, bipolar, as the name suggests, means you have two sides. You have depression and you have mania. In fact, it's often called manic depression. During your depressed states, it's very similar to unipolar depression, simple depression. So you feel very low, you feel very tired, you feel very lethargic, you feel very sad, hopeless, and helpless. During periods of mania, on the other hand, you have an inflated sense of ego. Anything is possible. You actually sleep very, very, very little. You may be able to rely on a couple of hours a night. And there's all these almost delusions of what you're going to do. So you don't go out and buy a bed. I had a client once who went out and bought 14 beds, 14 mattresses, because that's how high he was. And I use the word high because it's almost like being, if you can think of an emotional high when you're just so excited and just I can't contain yourself, and that's what the feeling is. You can't contain yourself, you can't stand still. And then you go completely on the other side and you become depressed again. And this can have a hugely detrimental effect on your ability to work and sustain relationships. Having said that, a lot of people are very highly functioning and have bipolar depression, and it depends on the level of the condition you have. For some people, bipolar depression, the manic stages are so extreme that they resemble things like schizophrenia. People become almost delusional. For others, they're very highly functioning, so they're very good at hiding it. In fact, you'll find that very high achieving people sometimes in some professions that they're very well paid, in the city, for example, may have this condition because it works for them. They can stay up late doing crazy amounts of work and doing deals, but ultimately it's something that needs to be addressed, and bipolar depression usually needs to be regulated by medication.
Bipolar and manic depression are the same thing, although it is more commonly known as bipolar. It affects around 1 in 100 people in the UK and normally starts in the late teens to mid-20s. People do overcome bipolar disorder, but like all psychological problems, it is important that you get help as soon as possible. However, do not be alarmed or worried. As long as you seek help as soon as possible, there is a lot that can be done to help you out. So it is important that you recognise whether you have bipolar or not.
If you're bipolar, have bipolar depression, then it's imperative that you see a psychiatrist and you get on the right kind of medication. If left untreated, it's very unlikely that it will resolve itself.